Hello students, I hope all of you are fine. In today's class, we are going to start the last part of personality topic, and that is assessment of personality. Till now, we talked about the meaning and definition of personality with its factors and types. Then we discussed about different theoretical approaches that was given by different theories like type approach, type cum trait approach, humanistic approach, social learning approach, developmental approach. In this is the last part of personality topic. In this we are going to discuss assessment of personality, means how we can assess someone's personality. If I want to know that what kind of personality I am having in my behavior, then how can we study that? So, assessment of personality, basically, we can assess someone's personality by using two methods. First is psychometric techniques, and then projective techniques. So, there are mainly two types of techniques. With the help of these techniques, we can assess someone's personality. Then, in the psychometric techniques, we are going to use some methods like observation method, case study method, questionnaire method, interview method, and rating scale method. If you remember, we have already discussed about all these methods. Observation method is also called as behavior method. So basically, if I am going to assess personality by using observation method, so that means first of all I need to observe the behavior of that person in different situations. And the most important thing about observation, as we have already discussed this thing in the methods of psychology also, that we need to use observation method in its natural setting. That means I am not going to tell this thing to the subject that look, I am observing you. So that is why observation method is most applicable on children's, animals, and mentally challenged people. Means if you want to assess the personality of small children's, then observation method is useful for them. Then the second method is case study method. In the case study method, it is also called as clinical method. And if I want to study someone's personality in depth, then this case study method is very much useful. In this, first of all, I am going to collect the case history from the client itself. Then I am going to take the case history from the client's family, parents, society, wherever he has experienced something in his life like school, college, job, environment. Means I am going to collect the overall history about this person in the case study method. No doubt this is a very time consuming method, but if this case study method once applied on someone, then the results obtained by this method will be more reliable. Then the next is questionnaire method. In the questionnaire method, there will be a list of questions, and the psychologist is going to give the list of questions to the subject, and the subject is supposed to give answers of all the questions. The answer may be in yes, no form, maybe agree, disagree. He is supposed to do tick or a circle or underline the answers. When he is done with the answers, then he is going to submit that answer sheet to the psychologist, and psychologist is going to do the analysis and is going to submit the analysis, and going to tell him, means tell to the client that this you have such kind of personality. Then the next is interview method. In the interview method, basically two people are required, interviewer and interviewee. When interviewer is going to conduct the interview to assess the personality of someone's, then he is going to give the time and the place to the interviewee so that he can conduct that interview. And in the interview session, the interviewer is going to ask some questions that are related with the personality to the interviewee, and the interviewee is going to give the answers, and the assessment will be done, and accordingly he is going to tell him that this kind of personality you possess in your behavior. In the rating scale method, the psychologist is going to ask some question from the subject, and whatever answer the subject is going to give, he is going to give rating according to that. So this is called rating scale method. Basically, rating scale is of three types: 3-point rating scale, 5-point rating scale, and 7-point rating scale. Right now this is 1 2 3 4 5 5-point rating scale. If any rating scale, any scale is having only 3 point, that means this is called 3. If xyz rating scale is having 7 point, that is called as 7 point. So we are going to ask question from the subject. Wherever the subject says that this is i i I have this answer, then we are going to rate the subject, and then after that we are going to make the graph. And now whatever traits this person possess in his or her behavior, we are going to tell them that you have such kind of personality traits. So why I was doing this so fast, because somehow we have already discussed all these psychometric techniques in the methods of psychology. You can go to the methods of psychology topic to uh, in my YouTube channel, so that you can again, sorry, you can go to my YouTube channel so that you can again uh, watch the video on these methods of psychology to understand more. Then the most important techniques to assess the personality of someone, these are projective techniques. In projective techniques, we are going to assess the personality of someone by using some different methods, in which one method is TAT, second is RIBT, then WAT, and SCT. TAT is thematic apperception test. RIBT is Rorschach Inkblot Test. WAT is word association test. SCT is sentence completion test. These are one of the most important methods in personality projective techniques. Now we will discuss all these methods one by one. In projective techniques, first of all, we are going to talk about thematic apperception test. In the thematic apperception test, basically, in this test, there will be this was, first of all, this was given by Murray, and in this TAT, there are mainly 3 sets of pictures, in which one set is for male, second set is for female, third is for male and female both. Means if in a group I am going to study on male and female both, then I am going to use third set. If I am just going to my research is only on female, then I am going to use the second set. If my research is only on males, then I am going to use the first set. Now in each of the set there are 9 to 10 cards. First of all, 3 sets of picture. These are 3: one for male, second for female, third is for male and female. Then in each set 9 to 10 cards are there, and on each card there is a picture. So that means overall we have 9 to 10 pictures in each set. So now how to administer this test? This was all about the basic thing about TAT. Psychologist is going to give you some papers and pen. Then I am going to give you some instructions that this test is somehow a subjective test, and I am going to show you I have 9 to 10 cards. On these cards, each card there will be a picture. I am going to show you each picture one by one. You need to see that picture for 2 minutes. Then with 1 minute break, you need to, means first of all you are going to see that picture for 2 minutes. Then for 1 minute you are going to think about this picture, and then for in next 5 minutes you are going to write a story to see that, means to recall that picture. And when you are going to write a story to see that picture, then there are mainly three things that you need to write in that story. What is the name of the character, means in that picture there will be some characters. It may be a male, a female, or some people they are working in a group. So first of all you need to give the name, then you need to write the past of that person, you need to write the present of that person, and right now and what is his future plan. So basically in that story you are going to write four important things: what is the name of the character in that picture, what was the past, and right now what he or she is doing in this picture, and what is his or her future planning. And nine pictures, nine cards have some pictures. The last card, 10th card, is blank card. Now again you need to see the blank card for 2 minutes with 1 minute break. Again you need to write a story. Now just imagine any name, any character in your mind, and then again write a story with that person's past, present, and future. When you are done with all the cards, means when you have completed all the stories, you need to submit the stories to the psychologist. The psychologist is going to assess your stories, means each and every word of your story is going to be assessed. Now after assessment of all those stories, the psychologist is going to tell you that what kind of personality you have. Now with the help of TAT we can assess 8 to 9 factors of personality. This is a very important. Basically, projective techniques are one of the most important techniques in psychology. With the help of these things, we can just find out all the things that are in unconscious minds. Means if XYZ person is not able to tell anything to anyone, then TAT, RIBT, these are one of the most you can say important tests. With the help of these tests we can just understand, we will be able to understand that person in a very depth. So, with the help of TAT, we can assess if XYZ person is having some kind of problem in his life. What is his or her future planning? Is this person is having any kind of fear or phobias or not? His or her family relationships, his or her sexual relationship, and fear and phobias. So, there are many factors that we can assess with the help of this TAT test. Then next test is RIBT. RIBT is Rorschach Inkblot Test. This is one of the most easiest test, and the most important thing about Rorschach Inkblot test, this test is applicable on literate as well as illiterate. TAT somehow is not applicable for illiterate because you need to write a story. But RIBT test is applicable on both literate as well as illiterate. Because what happened, first of all, let me talk about this person Rorschach. Why this person gave this name as Rorschach Inkblot test? So first of all, Rorschach Inkblot test was given by Rorschach. Rorschach, what he did, if you remember, when we were child, we all of us are having a pen with ink. So means what I used to do this thing, means I'm going to put some drops of ink in on the page, and then I'm going to fold that page, and then it is going to become an image. So that means what? Uh, Rorschach made thousands of blots like this, and he conducted research on these thousands of blots. And the blots that were the most meaningful blots, means most of the people they were giving the same answers to all those blots, and then from those blots he made this ink blot test. That is why this test is called as Rorschach ink blot test. Now what exactly we do in this test? Basically in this Rorschach ink blot test there are 9 to 10 blots that is made from ink. Now the psychologist is going to show you that 9 to 10 blots one by one. You you need to do only one thing. Whatever you are observing in that blot, you just simply give the answer. Now after completing your answer, and even this Rorschach ink blot test, I think there is one version that is applicable, that is I think I'm not sure, but that is on Google also. If you want to use this Rorschach Inkblot test on yourself, then if you are just going to type on the Google that Rorschach Inkblot test, you can use this test on yourself also to assess your personality. So you need to answer the whatever you are observing in that plot, and the psychologist is going to assess your answers, and accordingly he or she is going to tell you the report. Again, the the things that we can assess by TAT, the same areas we can assess by using RIBT also. Then the next is WAT. WAT is word association test. It is clear from the name. Word association means in this test the psychologist is going to say one word and you need to say the another word. For example, if I am saying red and your answer is rose, so red, rose, yes, red is rose, so that means there is some association between these two words, red, rose. So that means your personality is perfectly fit. On the other hand, if psychologist is saying red and the subject is saying elephant, this does not make any kind of association. That shows some kind of abnormality in the personality of that person. So this is called WAT. One word will be spoken by the psychologist, and the client is supposed to make the association with the same word. But the most important thing about this WAT is that the you will not be given any time to think about the associated word. Means the moment I am using red, immediately you should say rose. So that is called as word association test. Then the last is SCT, that is sentence completion test. It is just a bit vast to WAT. In WAT, the psychologist is going to speak one word and you need to speak the another word. But on the other hand, in SCT, the psychologist is going to speak one sentence, a half sentence, and you need to complete the sentence. Sentence completion test. Let's say if I'll say that I feel happy when I give time to myself. So that means what? This is sentence completion, and this makes some sense also that whenever I give time to myself, I really feel happy. So that means there is some association between these two lines. But on the other hand, if I am saying I feel happy, XYZ client says that when I see someone's death, so that means that clearly shows that there is some abnormality in that person's behavior. So with the help of these projective tests, we can assess normal as well as abnormal aspects of someone's personality. So that is why projective test in itself, they are very widely used methods, and we can assess normal as well as abnormal aspects of someone's personality. So this is about the assessment of personality. Now in the last, let's talk about some of the, you can say, applied aspect. You can say that what is the applied aspect of this personality topic, means how you can apply the knowledge of personality in your nursing area. So first of all, now all of you have the knowledge of personality. You are well aware about different types of personality. Now as a student nurse or as a professional nurse, now you are aware about the meaning of personality. It may be that before uh, studying personality topic, you were not well aware about the actual meaning of personality, but yes, now you have the exact knowledge about personality topic. Now you are also well aware about this. Now what are the different factors that are going to affect our personality? That includes genetic factor, family factor, society, culture, and your own personal experiences, and you can even work on that also. So with the help of types of personality, you can simply assess your personality, that what kind of personality I am having in my behavior. Then there are some different approaches. You will be able to find out your traits, what are my constant traits, what are my unstable traits, and are you stable introvert or stable extrovert, means type cum trait approach you can apply on yourself. Similarly, you can say now you will be able to find out that when the id component is the main component of my personality, when ego comes or when super ego comes. Similarly, with the help of Eric Erikson theory, you will be able to find out that if I am what are the positive points I am having in my personality, and what are the negative points, means where am I lacking, and I am not responsible for that. There are certain factors since childhood that are playing important role in the development of my personality. Then after that, yes, I can assess my personality. It may be that right now we cannot do this thing online, but yes, maybe in future we can do that thing. But yes, if you want to know about your personality, simply type on Google. I think there will be some psychological test related with personality that are available on the Google, so you will be able to understand your personality. So basically, and the same thing you can apply on the others also. So, the most important thing, first of all, apply the knowledge on yourself, then slowly and gradually start applying the knowledge on the others also. And then, yes, when first of all, this thing you must understand that while working in the hospital setting, you are going to deal with many of the patients. It may be the patient suffering from the same disease conditions, but because their personality style is different, so their reaction towards that disease condition will also be different. So we can work on them also, so that we can work according to their personality styles. And we can groom our own personality also, that is inner personality as well as outer personality, with the help of personality topic. So this is all about personality topic. I know this topic was very lengthy, that is why I divided this topic in 5 parts. I tried my best to make you understand, but still, if you feel like you have any doubt in this topic, then please don't forget to write in the comment box, or you can say, simply type and you will be able to find the answer. So this is all about personality topic. uh, Take care, bye bye, we'll see you in the next topic.